My name is Tom Peck. I live in Eugene, Oregon. I've had 3 ceramic implants from Lotus Dental, and would just like to speak a little bit about it because I really appreciate this dental office. Originally, I was skeptical. It's a long drive. It's 2 hours for us, and my wife actually got me to come up here. Before that, I went to a dentist in Eugene, and I told the dentist, please don't fill my cavities with amalgam. And so got home. It said on the receipt, amalgam fillings. Called him and I said, no amalgam. And he said, oh, really? And I said, yeah, you don't. So he tried to blame it on the staff and this and that. And I said, no, you're the one. I told you specifically. So we came up here. I came up here. Cathlin had already started seeing Dr. DeLong. They removed all the amalgam. They did it with using vacuum and protecting not only me, but the staff as well. Everybody was suited up and masked up to protect them from the amalgam, which most people don't realize how toxic amalgam is. So it was removed and replaced with I forget the name of the filling. What's it called? Composite filling. So the other dentist was charged for those services. But like I said, I've had 3 implants. They used robotics to locate exactly where and how deep and all that, and it worked out perfectly well. The recovery was very minimal. I was really in no amount of pain through the procedure and through the recovery. I really personally like Dr. DeLong. He's very personal. He's super knowledgeable. Unlike many dentists, he takes dentistry to the next level where he studies it, is really kind of an expert and in terms of ceramic filling or ceramic implants, he is kind of on the cutting edge. I know he's been to Europe and studied with the person who first designed ceramic implants. And but I feel like the whole office and Dr. DeLong, but the dental hygienists really take care of you and pay attention to detail. And we've been coming here for about 7 years. And I couldn't recommend a better dentist. This whole office is just awesome. So I could rattle on for a while, but I think that concludes my thoughts for this testimony.
Well, I had a long history with health issues that I didn't know were related to my teeth. And I had many root canals and 1 titanium implant that my body rejected. And I hadn't known that all of those health issues through the years were related to all of the botched root canals and the titanium implant. So when I actually had my first ceramic implant in California and found out about them from my dentist, and then through her, I found out about Dr. DeLong here when we moved here, and then subsequently I've had 4 more here. And I got to say, my health has improved dramatically, and it's now, they're stable. With the old titanium implant, literally there were cysts when they pulled it out. It was so infected. I felt sick all the time, and headaches, and nausea and aches, kind of random aches everywhere. And these, not to get graphic or anything, but these root canals, when they pulled them out, there was pockets of necrotic tissue. And when I saw it's called a cone beam CAT scan that they use, which does a 360-degree view of your entire head. And most dentists use films that only go down to the jawline. And when you get a cone beam CAT scan, as you do here, that you see everything down your neck. I could see down my neck. I even saw a cyst that I had in my sinuses that I didn't know I had. So it's pretty enlightening.
Wow.
Yeah, the ceramic implants are biocompatible. They work really well with your entire body, and so I owe so much to Dr. DeLong because my health has improved immensely, and I appreciate that the office focuses on not just your teeth, but your entire body and your well-being, and how your diet, your exercise, your lifestyle, all those things affect your mouth, your teeth, your whole body. And again, I appreciate that they use the biocompatible materials and ozone and less invasive techniques. So they won't take the whole tooth if they don't have to take the whole tooth. And I also really appreciate that Dr. DeLong and the whole staff have a really good communication before, during, and after a procedure. They describe to you what they're doing. They tell you exactly what they're going to do, and then they walk you through that procedure really well. So it's been a really great experience here. I feel like we've healed faster, and we're more healthier in general because of it. Mm-hmm. And it's just been an all-around great experience. So.
Can I just add, in terms of the robotics for the implants, I've read, and also Dr. DeLong explained, it's very precise, and most dentists don't invest in that and don't use it, so they kind of guess at the location of the implant and the depth of the implant. They first put in a kind of a screw that is attached to the tooth, but it's kind of guesswork for most dentists who don't invest in that, which is really for the patient's health and healing. And that's just yet another reason why I like coming here, that Dr. DeLong does not skimp on technology. He's got the latest in terms of your chart. You can see every tooth that's been worked on, and
you can see while he's doing it. You can see what's going on with the monitor, which is nice. Yeah, I love that.
Most dentists don't even come close to that. Still,
and he loves what he does. He loves being a dentist, and he's so into the science and the art of it. That's so rare. He's just like jazzed when he tells you about something new, or when he's, working on you, he's going to describe what he's doing. It's really refreshing.
And we saw, we were here before he started using the robotics. So we've seen this dental office expand and develop, and like I said, we've been coming for 7 years, and it's really a beautiful thing to see that he is really building an institution that is amazing and important to our health, and I can't recommend it more to to folks who are considering having implants. So
Absolutely. Yeah, and all the staff, you know, all of the folks who work here at the front and the hygienists, and they're all really good at, I mean, communication is key because it's invasive having somebody in your mouth. And so you want somebody who's going to tell you what they're going to do, what the process is, what the procedure is going to be like. And it's great. It's great to have folks who do that.
you know any good jokes? Any dentist jokes?
Any dental jokes? I don't think so.